You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello, and welcome to another episode of the RN Mentor podcast. I have a very special guest with us today, Dr. KT Waxman. Dr. Waxman is a national nurse leader and executive with extensive experience in healthcare and corporate settings. She is an associate professor at the University of San Francisco and is the director of the Executive Leadership Doctor of Nursing Practice Program. She is also the director of the California Simulation Alliance and Health Impact. In addition, she is the editor-in-chief for Nursing Administration Quarterly, an internationally known speaker and author. Dr. Waxman is also a past president of the Association of California Nurse Leaders and past board member, serving as treasurer for the American Organization of Nursing Leadership. She is currently the immediate past president of the Society for Simulation in Healthcare. Dr. Waxman's work has been published extensively and can be found in the Journal for Simulation in Healthcare, Clinical Simulation for Nursing, Journal of Nursing Education, NAQ, Nursing Leader, and Creative Nursing Journals. She has authored 3 books on finance and budgeting. She co-authored a simulation book, Healthcare Simulation Program Builder, and has authored several chapters in simulation and leadership textbooks. Dr. Waxman received her DMP from the University of San Francisco, with an emphasis on healthcare system leadership and a concentration in clinical simulation. She holds certifications as clinical nurse leader, executive nursing practice, simulation health educator, and is a fellow of the American Academy of Nursing, the American Organization of Nursing Leadership, and the Society for Simulation in Healthcare. And her full bio is on my website for everyone to see. Welcome to the show, Dr. Waxman.
Thank you so much for having me.
I feel so inadequate when I read that, so I don't know. And you have a family, and you also take vacations once in a blue moon. Uh-huh. So how are you?
I'm good. I'm busier than I have been in a long time with the pandemic.
Yes, I can imagine. I think we're all sort of in that same boat, and it just doesn't make sense. I feel like I'm doing more but less productive for some reason.
Yeah, I hear you, and I have Zoom fatigue and Zoom brain and need to walk more. That kind of stuff. Self-care is so important.
It is absolutely. Before we get started, we have known each other. I really got to know you from a simulation perspective years ago when I was working with simulation program, and that's where, I don't know if you remember.
Yeah, Valley Press or
Valley Presbyterian Hospital. Yeah, we had just built the sim lab over there, and I was the education manager for the sim lab and kind of helped build that program up. But let's start with how you got started in the world of nursing and eventually ended up with everything that I just read about, right?
Alphabet soup, right?
Yes. How did you start in nursing? What drove you into that world?
Well, I started as a CNA when I was like 16 or 17, and I worked in a nursing home. So I've always had a fondness and a passion for gerontology. Oh, wow. And so, I was kind of thrown into the nursing home world. And then when I graduated from high school, it was a natural progression to apply to nursing school. And it was funny because I'm an ADN grad who has a doctorate degree. So I really believe in lifelong learning, and I believe that the ADN is a launching pad for higher learning. And that was my plan altogether. But I applied to nursing school, and I was the seventh alternate. And in the community colleges back then, you're either in or you're on a list. And so I remember that I was notified of that, and then started classes. And then on Thursday, I got a call saying, "You made the cut. You got to start tomorrow." And that's how it all started. I would have tried again, but that's how I started. And at that point, we were taking microbiology and A&P at the same time we were in nursing school, which they don't even let you do that anymore. But I did it, and that was. I knew I could do it because I was one of the few people that had to do all my prereqs at the same time.
Oh, wow.
Yeah. And so from there, once I graduated with my RN, which was an IP at that time, an interim permittee, this was in the Bay Area, and I decided I wanted to get the heck out of Dodge, and I drove to LA and applied at UCLA Medical Center, got a job as an interim permittee. Started there for a couple of months and ran home at lunch every day to see if my board results came. And at that point, if you had a big fat envelope, that was a good thing. And so, you're sweating it every day. But I passed on the first time and got a significant raise. I mean, I was probably making $20 an hour, back then.
Big bucks.
Yeah. And then I immediately enrolled in classes at UCLA because I wanted to go get my bachelor's degree. I ended up getting my bachelor's degree in healthcare administration because I really wanted to move into that, and my master's in business. And people say, "Why did you get an MBA and not an MSN?" And at that time, in when was this? The 80s, I guess. In the early 90s, we're very budget focused, numbers focused, managed care had just hit. And I thought, to differentiate myself in the market, and I want to be an administrator, I will get an MBA. And so I got my MBA from University of Laverne, which is down Southern California.
Mm-hmm.
And then my dream was always to complete my doctorate degree, but did not want to get a PhD. Like some people I know in this room, because I'm just not a research heads down person. I really wanted the practice component. I looked at organizational leadership and that kind of thing. And it wasn't until the DMP came about that I said, this is the degree for me. And so I got my doctorate degree in 2008 from University of San Francisco. We were the first DMP program in the state.
Yeah, I was going to say USF has been sort of the lead on this on the DMP program for California.
Yeah.
Now that's fantastic because we have so many. You mentioned the ADN program, and I years ago I was very much on the bandwagon of entry level needs to be BSN, right?
Mm-hmm.
I'm not on that bandwagon anymore. I think there should definitely be transitions to BSN because I don't think the ADN should be a terminal degree. But the ADN is definitely a way for a lot of individuals to come into the nursing world. And I think it definitely has a very important part in nursing. So so I know there's people out there that will disagree with me, and that's fine. I have moved on from that point of view, and I think it's important. And you're a prime example, and I have students right now that are in the ADN to BSN program, and they're incredible individuals, so smart, getting their work done, managing a family. So kudos to all the ADN program graduates that have moved on and are thriving in the nursing profession.
I had the opportunity to be a plenary speaker at the American Organization for ADN Programs, ODIN. Mm-hmm. I think I have the acronym wrong, but it was amazing. I mean, they do such great work, and they're such great nurses, right? And most of them will go on for the BSN. Most of them will, but if they don't, they're still nurses, right?
Right.
And so, I'm a product of that, and it's not for everybody to get their doctorate, but I'm just one of those who started as an ADN and went up. So I like to talk to ADN graduates radiant students because, you know, the test is the same. And I
Yeah,
know,
it's the same. It's the
right?
same NCLEX. Yes,
Nobody understands, entry-level masters is the same
right.
test as BSN and ADN. So, a lot of people are pushing for BSN in, 2020, 2030. In California, will that happen in my lifetime? I do not think so.
Right.
We have, 75 ADM programs in California?
There's quite a few. Yeah.
Right.
Yeah, I agree.
And until things change where it's easy access to university, they're not going to go away. So these bridge programs are wonderful, and we need more of them.
Yeah, I agree. Like I said, it's such a significant impact on the lives of the people that are going into the ADN program, and they graduate and are able to get jobs as nurses. That step up and that opportunity.
Yeah.
I can't imagine not having them around.
Right.
Like you mentioned, it's accessibility and time. All that stuff needs to be considered. So I completely agree with you. Now let's talk about, like, you did go through this pathway. How did you decide that you were going to move on to your different degrees? Right? Was that just so your own drive? Were there people in your life that sort of cultured you or help you grow into that?
Yeah, absolutely. And I know you're going to talk about mentors, and I am a mentor, but back then I needed a mentor. I still do, but my mentor is the one who pushed me into it. Okay. So I was a nurse manager with an ADN degree. And my mentor said, she was the VP for Patient Care Services. She said, I'm hiring you into this slot, but you have to have your bachelor's within X amount of years. Okay. So I had to. Right. And then, I always wanted to, but the hospital actually paid for most of it too. And that was another incentive. But back then it was like, bachelor's, RN required, bachelor's preferred. Then once everybody had their bachelor's, BSN, then it was BSN required, master's preferred. And now I'm seeing, master's required, doctorate preferred. It's very interesting. So yes, I had a mentor.
Yeah, I've seen that, and I know there are some institutions that have, at least at the nurse executive level, have moved on to doctorally prepared nurses and are kind of moving that direction. So yeah, definitely. But I think there needs to be for even the institutions that are saying bachelor's required. I think there should be they should build in pathways for people for their ADNs to be hired and move on to get their bachelor's. That should be like perhaps a requirement that, we'll pay for it, but the expectation is that you put in the time and effort and to do that. So I think, and that's one of the things I see with a lot of our ADN students is they're having a hard time getting that first initial job because so many hospitals are looking at Magnet or looking at the bachelor's being entry, and I see ADN.
Magnet can hire ADNs as long as they have a mechanism to help them grow.
That's the key is you can hire them and help them grow, and it only looks good for you to have that professional pathway from a Magnet perspective, I imagine.
Exactly. Yes, and we're facing a major shortage. Yes, we shouldn't be turning away anybody at this point. I mean, when I was, let's see, what year was that? Gosh. When I was a manager in the late 80s and I was a director of ICU at the time, we pretty much hired anybody who was breathing and had a pulse, with an RN degree. It's like we were so desperate. Right. And, travelers and registry and all of that. And we're going to get to that point again because we have high turnover in nursing in the first 2 years. If they're not treated nice. By their preceptors and their colleagues, which there's so much bullying going on, they choose to leave the profession. It's so sad. Right. And then the projections are showing that we're going to be down, hundreds of thousands of nurses in the next 10 years. So.
Right. And if social media is any indication of people leaving the profession or leaving bedside as a result of the pandemic, then we are going to be shorter than we are just with regular attrition.
Right. And the care will be in places outside of the acute care hospital.
Right.
And that's the other thing. We're training, for the most part, we prepare our nurses to practice in acute care hospitals, right?
It is. And actually, that's one of the things, that's one of the programs I'm glad I saw CalState LA and several other universities bring on, is the ambulatory care setting sort of edition, which we've been doing for a couple of years now, but we definitely need more of that. That we're preparing our nurses for more than just bedside. So very important.
Yep.
So career-wise, you were at UCLA and you went into a sort of administration, and you went the MBA route, which actually a lot of people that I know that want to do administration, and they always tell me, what should I get my master's in? I want to get an MBA. I mean,
you can't go wrong. You can't go wrong,
right?
No.
And actually, a lot of organizations I know actually hire MBAs especially in ambulatory care settings, right? They hire MBAs in the management roles. I mean, I'm like, why don't you be a nurse that has an MBA? So it's definitely something for people to look at. So that was I want to say you're a little bit of a visionary for me, just because from the fact that you're also sort of an early adopter of simulation, and that's been a big part of your career. Let's talk about your simulation life. How did you get started in simulation? Like, what was that drive? Because
yeah, I like to say I was in the right place at the right time. Okay. I mean, we've been doing simulation forever, right? It started with an orange and injecting into an orange, your colleague's arm, starting an IV. These are all types of simulation, the head, the arm, the task trainers. And in 2004, I think it was, Dolores Jones, who was another one of my mentors, she was the founder of the California Institute for Nursing and Healthcare. And she called me one day and she said, KT, would you facilitate a meeting for me? I'll pay you $50 an hour because we're growing. And I was in transition at the time. I was consulting. And I said, sure, Dolores, I'll do it for $50 an hour. Great. And I facilitated this meeting. And at that meeting, it was announced that the Gordon and Betty Moore Foundation had earmarked $100 million to nursing education in the Bay Area, the 5 counties that touch the Bay. And she said, KT, I want you to write a grant for that. So I was the person who wrote that initial grant for the Centralized Clinical Placement System, CCPS, which is all over California. And then from there, since we had a track record for managing that grant with the Foundation for California Community Colleges, FCCC, our partner in that, I wrote another grant because simulation was starting to blossom. And so I wrote a grant for about $1 million to create the Bay Area Simulation Collaborative, which is also known as the BASC. It's still in existence today. We were funded with 3 goals. We had to do training, like preparing and educating faculty and educators from those 5 counties. We had to create scenarios, and then we had to do some research. So I managed that grant for 3 years, and then launched the California Simulation Alliance off of that. And the BASC was a demonstration model for other areas within the state. I had the great fortune of going to Southern California in the late 2000s, and we were funded by Kaiser Permanente Community Benefits out of Pasadena to replicate the model of the BASC in Southern California. So we have 2 solid models, and then we currently now have 7 regional collaboratives all over the state.
Oh, wow. That's amazing. And I was one of the beneficiaries of the Southern California.
Yes.
That's how you and I met many years ago.
Yeah.
It doesn't feel like it's been that long, but it's been probably around 10 years.
It must be
10, 11 years.
About 10, 11 years. Absolutely.
Like
with Carolyn Orlowski, we used to travel around together.
Yeah.
And so as you said, I was an early adopter. I was an early adopter, and I really utilized Roger's theory of innovation and looked at the people that were in the audience, because everything we did was free because it was grant funded. So come to a class, it's free. And so we had hundreds of people in the audience. Some of them were were not believers. And I'm like, how can I convince them that simulation is the right thing to do? Because I was a believer from the very beginning. And then I, read his book, and I was like, I don't need to even bother with these people. They are not believers. I'm focusing on those people who raise their hand and are in the front row right now. And those were the first faculty that we had trained to do train the trainer and write all those scenarios. And the funny story is that I had one faculty member who was probably pre-retirement. And she just sat there with her arms folded, and she said, they made me use PowerPoint, and I hated that. Now they're going to force me to use simulation. And I was like, okay, you're a laggard. I'm going to leave you alone and not bother with you. I'm going to focus on these others. And then we used to do a conference called Magic and Teaching. I think you probably attended some of those in LA.
I have, yeah.
And all of a sudden, this woman comes up to me. She says, do you remember me? Oh, yes, I do. And she said, well, I'm a believer now. I was going to retire, but I discovered simulation. I'm staying on. And I was like, okay, I made a difference in an indirect way, right?
Yeah, that's great.
Yeah,
Actually, I want to say I've done like 2 or 3 of those magic and teaching conferences. So yeah, love doing it. Love simulation. I want to talk a little bit of simulation with you. I had a chance to, at the last facility I worked at, when I became the director of education for that facility, we did simulation-based competencies. So they were doing paper pencil stuff, competencies, and then I moved them to the extreme of simulation-based competencies, where they happened to have an MT unit. We converted that MT unit into Sims galore, and we had them go through small groups, and do simulations, and did all the prep work and debriefings and stuff like that, which actually I saw some outcomes from that, but a lot of the research at the time I was looking at really has to do with, like, it talked about like nurses being comfortable with things and not, like having simulation directly impact the outcomes of patients, right? What's going on with that arena? I've been a little bit out of the sim world. So do you think there's opportunities for us to do that kind of connection?
Well, I think a lot's happened in the last 10 years. And I think that what we know is that students like simulation.
Right.
Okay. So don't produce a study that shows me that they liked it. Okay. Because it's been done. It hasn't made a difference. It hasn't made a difference. And what we've learned is that we can guarantee a clinical experience in simulation. We cannot guarantee it in the hospital setting.
Yeah.
Especially when they're doing observation only. And the Board of Registered Nursing says that 75% of all hours need to be in direct patient care. Now, It's different now because of COVID. We have a waiver to do up to 75% simulation in certain areas, with certain criteria, like if you can't get a clinical placement. And we're hoping that that will continue with those guidelines going forward. But there's been a lot of studies on, competency and performance. Absolutely. They're using, OSCEs now with simulation for FMPs training. And we've learned a lot along the way. What we've learned also is that there's not a lot of evidence that the clinical experience makes a difference. And so, you check off the box that your students went to clinical. The clinical instructor is on 2 or 3 floors running around. It depends on the preceptor. There are a lot of variables that go into that. Right. And at the end of the day, after 8 hours, what boxes can you check? But did you talk to a patient? Did you touch a patient? Were you responsible? Could you give meds? All those things. But we can do that in sim. And they can't hide. The students cannot hide in sim.
That's true.
So there's a lot of controversy out there right now regarding the number of hours. And I'm not one of their biggest fans. The CNA component of the BRN doesn't really support sim or what I have to say. So I'm just going to disclose that. Right. But there's a controversy regarding hours. So 1 hour of clinical equals 1 hour of sim currently in the regulations from the board. But there's evidence to show that 1 hour of sim can actually equal 2 hours of clinical, or even 3, depending on the situation. And there have been studies done out there that have reflected the learning occurs in sim more than in clinical. So some schools have actually waited till their final semester to put them in clinical, doing sim, and then clinical. We do it differently here, and we're struggling, right? Well, we can't get my clinical placement. What am I going to do? I also learned that the minimum requirement of hours in California is around 600, but some schools are doing 1,000 hours, 1,200 hours. So when you look at percentages of sim to hours, it's different if it's 600 versus 1,000, right? And then we're like, why are you doing 1,000? Why are you only doing 600? Right. So all these things are bubbling up during this pandemic, and questions are being asked. We don't have any answers yet, but I think this is the time for us to document everything that we're doing. And then once this is over with, say, no, we're not going to go back to the old way. Right. Here's what we're going to do. We're going to be outcome-based, right? And competency-based, rather than checking the boxes to say that you went to OB and you never saw delivery, right? But you went to OB.
Right. And that's been one of my biggest I think struggles whenever we've ran into the issue of how much sim we can do. With sim, we can guarantee the experience of them interacting for a specific situation. I can tell you some of the experience I had, and I'm sure you the same way. That we went to a unit, we spent all day, but I didn't do anything new. Or I didn't if I was on a respiratory unit, that's all I did was respiratory. Right. I didn't do anything beyond that. Well, other students in the same clinical were on a different specialty unit and didn't get any respiratory like I did, but got a whole bunch of another thing. So I definitely agree that there needs to be better coordination. So it's more holistic, right? As opposed to we've always done it this way, and this is the way we're always going to do it, right? So yeah, and the same thing with nurse practitioners or graduate students. I think we're running into the same issue of even when you look at scope of practice, you can do it now, but not later after the pandemic type of stuff. That stuff just drives me a little bit bonkers. Yeah. So thank you. Thank you. I can talk sim all day. How about your, so you are involved in a lot of other organizations besides your daytime job, I kind of like to say, right? What was your motivation around getting involved with those organizations, and what made you decide, because you've actually had multiple leadership positions, what made you decide you want to lead those organizations, and where?
Yeah, that's a good question. So I've always had these leadership skills for many years. In high school, I was the president of my class and always led lots of different efforts. And so when I became a VP for patient care services, I was 31, by the way, 31. Okay. I'm looking back thinking I didn't know anything. And there I was, right? And I was working for NME, which is National Medical Enterprises, which is now Tenet Healthcare. So I learned on the job, right? And I didn't have any leadership classes. I actually was charged with creating a course on leadership. So I learned with the learners on leadership theory and whatnot. And now I'm running the executive leadership DMP program, which makes complete sense after all of these experiences. But I realized that the leadership skills that you're born with and that you acquire are completely transferable. And so when I was the president of the Association for California Nurse Leaders back in the late 90s. I was a board member for the American Organization for Nursing Leadership as the treasurer. And then I became president for the Society for Simulation in Healthcare. And what do I know from that? Well, I took all of my leadership experience and transferred what I knew into that arena, because I was the third nurse president in 20 years. It was a very physician-driven organization. Now it's not. There's more nurses than there are physicians. And then we have another segment of the operations specialists. So the engineers and the IT guys and the sim techs. Right. And so working with an interprofessional group is, I think, another critical skill that we need to train our students in, because once they get into practice, they're not in a silo. They're working with a team. So all those things prepared me for that president role, because I was sitting in between two MDs as president, bookends, and they have a whole different mental model.
Right.
Nor had either of them been in official leadership positions, and I had been. So, it was sort of like political, when I go in there with what I brought to the table, but I tried really hard. And I think I was successful in being professional and including everyone, which is another thing that you learn as a leader, is that you need to be inclusive, you need to listen, you need to communicate effectively, and treat everyone fairly.
Yeah.
So
sound advice.
Yeah.
I'm taking notes as you're saying this stuff. For somebody who's looking to, because one of the things, like, when I talk to some of the individuals that come to me for advice, or what should I do, or what, how should I move forward? What would you say to those individuals looking to do something outside of like their day job, right? They want to get involved in the profession of nursing, right? Not just their 7 to 7. How do they? What would you say would be a good way for somebody like that?
That's a great question. I think early on, I started joining my professional organizations. So. And attending all of those, regional meetings to network with people. And it's very important to network and be visible and be out there and meet people that are doing different things than you and stay connected to them. Now, back in the day, there was no LinkedIn, but now there is. And I think LinkedIn is something everyone needs to go in and update their profile. If you've seen my LinkedIn page, I have, 3,000 connections or whatever it is. And, I work with people on LinkedIn. It's professional. This is the forum that we can use, especially in these times. But once the pandemic is over with, or we have a vaccine, get out there and network. Join your professional organizations. Even, go to the Rotary and say, I'd like to talk about healthcare. I did so much. I did Rotary. I was just out there doing whatever I could to get known and to network. And that's how I got jobs and opportunities. Years ago, it must have been in the early 90s, remember Nurse Week had like these regional fairs. And I was a presenter there. And I remember one of the topics that I presented was nursing opportunities outside the hospital walls, like being a consultant, working in, home care, all the things that are outside, and become more entrepreneurial. And I have a chapter in my book, my finance book, on entrepreneurship and, marketing yourself and marketing different programs and products. And I think nurses are the perfect folks to do that. They just don't have the skills or the bandwidth. And, nursing is the best profession because there's so much opportunity. I believe that everyone needs to get at least 2 years of clinical experience before they go out on their own as a consultant or do something different, because the credibility is so important. I was 5 years at the bedside at UCLA and Cedars-Sinai, and the critical care, float pool, and I can tell stories like anybody, right? You have to have stories, you have to have experiences for credibility.
Right.
And then you can get these other degrees and go out into the other industry, but you have to have that credibility as a nurse to get there. And I think that's one thing that I did early on was I was in the trenches. I think that's critical.
Yeah. No, I agree. That's actually one of the things I always, when I talk to my students, I say one of the skill sets that they should gain is they need to learn how to market themselves. Like build your brand, just like think like your Nike or your, any Adidas or whatever else you want to think of. I said, think about branding yourself, and that's how you need to move forward. Because I think that's one of the biggest things. Nurses are just not good about talking about themselves. And I think that's a comfort thing. So I tell them, when you build your resume, when you build your portfolio, when you get a business card, think about what is your brand and stick to that theme and brand and sell yourself, right? Not physically for sell yourself, but but virtually, build your brand and market yourself, because that's how you're going to be able to. So that's great advice. I'm glad I'm
Yeah,
collecting the
and
right
the CV or resume is one thing I wanted to add. You brought that up. I have a CV that is like, I don't know, over 20 pages long, and I have a resume which is shorter. So my CV, everything I've done, I've documented, and that's what advice I would give to people. If you do a presentation, even if it's at a staff meeting, in 1 hour little module or something else. Write it down. And I have every presentation I've done, every publication I've ever done. Of course, I'm in academia, and that's required and part of the whole deal for the fellow in the American Academy and all that. But I didn't have to start from scratch because I had been writing it down for 30 years.
Right, right. Yeah, I have a little notebook that I carry. So every time I do something, I jot the date, the
Right.
time.
Yeah.
If there's any kind of documentation, the documentation. I have like a big old 4-inch binder that it goes
Yeah.
into,
Right.
and then I scan it and it's in my computer. So yeah, that's definitely like so many of my students, because I talk to them about portfolio, how to build their portfolio. They're like, I didn't keep everything. I'm like, start now. If you
Yeah.
didn't keep it, at least document what you've done, but keep everything,
Yeah.
because you never know when you're going to need to, pull on that experience or that, event that you participated in or you're presented with. So well, I'm glad I'm giving people good information.
You're right
You're
on.
verifying everything that I'm doing. I'm like, I'm feeling good about myself now. So thank you. Now you're involved with also with writing, and I want to touch base on your writing, and you're now the editor for NAQ. Um, um, how's that experience for you, and for those of us who are, I struggle with writing,
Mm-hmm.
and not because I think it's just I'm my brain is going a million miles an hour sometimes, and it becomes difficult. But I really have to sit myself down to write. What is your advice for some of those up and coming writers that are looking to publish their work out there?
No, that's another really good question. I've often thought about doing some writing workshops as well. With my new role, I was just starting. I'm in there almost a year now, so it was a steep learning curve for me to be an editor in chief. Just the software and all of that. I would say I think I wrote my first article when I was a nurse manager for. It was just a 1-pager, and I got it published. I was so excited. Now I'm much more scholarly, but and I have that article that I wrote. But I would say get a buddy. I believe in writing teams. I think that these are really good. Some people are really good at the introduction and background, and some are good at the lit review, and some are good at the wrap up. So when I'm on a writing team, we do an outline, we agree on the outline, and then we assign sections, and we send it back to everyone, and they edit it. So we're all participating in everybody's section equally, and then the first author is the one that's just leading it. And my goal in the next few years is to become the second or third author on these teams, because I don't have to be the first author anymore, and I've got a journal to run, and that's keeping me pretty busy. And the third edition of my book, my finance book, that I've got to do this coming year. But I would advise people to just start, take a class. There's a lot of online classes. Understand what APA means. That's a very common for nursing, is APA format. Right. And but not all journals use that. Some use. There are several others. So look at your journal guidelines to see what they require. But get with somebody and say, "Hey, I have this great idea. Would you like to write with me?" And then get a mentor to look at that manuscript, that final draft. Have them give you feedback, and just welcome feedback. That's the other thing is, and if you get rejected, you get rejected. Right. I have been rejected on many, many manuscripts. I've been accepted on many, many. I've also run for board positions and lost, and then I've won. So you just have to suck it up and move on. I mean, that's the thing. Don't take it personally. Learn from that experience and move on.
Yeah, I think that's a really great advice, is the fact that be okay with not getting accepted with writing, or losing a position or failure in general, I think is a good way to put it. I always, I don't want to say I always welcome failure. I don't always welcome failure, but I should.
Yeah,
So,
well, you can reframe it. It's not failing. They weren't looking for that type of a manuscript.
right. And
Try
actually,
another journal.
yeah, I ran into that right after my dissertation. I wrote about the veterans with less than honorable discharges, and my audience that was trying to get it published with, just those journals were just not having it. They were like, and one of the editors actually wrote me back and said, "There's no." They said that it's good, but my audience is not going to review it favorably. And that was their thing for not. So it was I went different routes and still spread the message, but that's definitely something to be okay with.
Right.
Find other avenues other than publications, but your material is not always going to be accepted. I do have one final question. Well, two final questions for you. From a perspective of a nurse leader, where do you see nursing going overall? Because there's been some transitions in nursing, and I see some stuff like, for example, of a lot of not a lot of educators, some educators looking to change and shift how we do nursing education, and we see some shifts within the role development of nursing, of kind of not just defining mostly how we're getting defined as bedside. There's a lot of nurses out there that are being more vocal about nursing. How do you see the future of nursing moving forward, as more of a sort of not taking a backseat to other professions within healthcare?
Yeah, I think this is nursing's time to lead. I think that we deserve it. I think we're well equipped, we're skilled, and we need to be at the table with decisions that are being made. I think we can partner with our physician colleagues, our ancillary colleagues, to along the continuum as we move forward and learn from the pandemic. But nursing needs to be at the table. And I was disturbed when Biden didn't have a nurse on his COVID task force. He does now.
He does now.
I was on Twitter, at Biden, at Kamala.
Right.
And so now he does. But that, it's like we have the skills, and Gavin, nursing needs to be at the top and lead the effort. So I think it's nursing's time. I think the profession is rich. We're the most trusted profession. We have a lot of wonderful nurse leaders out there that can articulate what healthcare needs and the future of healthcare from not only clinical perspective, but a financial perspective. We have nurses that can do that work. We have a different model than medicine, and we need to figure out how to work together better. And instead of dissing each other, we need to figure out how to work together. And I think I've seen a lot more of that in an interprofessional way over the last couple of years than ever before. So I think it's a great time for nursing to step up.
Yeah. And I think perhaps, from this point forward, I think there's an opportunity. I'm hoping there's an opportunity for the different schools, as they're putting people through, to work more intercollaboratively than we have in the past. I mean, if social media is any indication, like I see, and I think it was the American Emergency Medicine or something like that, put some information out about how to stop the what they call it, stop the creep or something like that. Of like they're talking about nurse practitioners being in those roles. So being in advanced practice roles, or being in independent or full practice roles. So there's some movements by certain organizations to actually stop the forward movement. And I don't know if they'll be successful or not, or maybe slow things down a bit. But I think there's definitely opportunity for the groups to work together and not worry so much about I need to be at the head of the table and nobody else, which kind of seems something. But then there's a lot of support also building within the physicians and nursing in that intercollaborative environment. So I think that's great too.
And I think simulation is really pushed us to that. Interprofessional simulation is very big. And I think it needs to start in school with our learners and then transfer into the hospital setting. I know when I graduated, I had never called a doctor in the middle of the night. I had never really known what a respiratory therapist role was. And I think we need to train them together rather than in silos.
Yeah,
so
I agree.
I think that's something that's missing in the U.S. In other countries, they do it differently.
Yeah, I agree. I definitely agree. Well, thank you so much. I'm going to give you one more question, or not even a question, a few minutes to, if you want to, anything else you want to talk about. I know you have a new edition of a book coming out, or anything else you want to talk about. This is your time.
Sure. So back in the 90s, I realized that nurses didn't have a lot of experience in finance and budgeting. So I wrote that first book in the early 2000s. It's in the 3rd edition. And then I wrote a book, Finance and Business Skills for the DMP student, the textbook, and it's going into 3rd edition. And it's funny because what I'm saying right now, I was saying in the 90s. It's like nothing has changed. And that saddens me. I think that more programs are picking up, finance courses for nurses, but I think that's a missing skill that nurses need. And it's really not reading a financial statement as much as it is building a business case and articulating what your need is. Like you say, marketing yourself. Like I need a nurse educator, a CNS on my unit, and this is why. Here is the business case. So I hope that that more finance and budgeting skills and business skills will be integrated throughout nursing curriculum in the future. And I would just say that I have never looked back. Once I got my nursing degree, I've never looked back. I know some people, as they move up in administration, have removed the RN from their business card. I never did that. I've always been proud to be a nurse, and I've always appreciated the profession and what it's afforded me and all the opportunities that I've gained. And so right now I'm really focused on mentoring others and succession planning, because I'm not going to be doing this forever. But it's been a great ride. I still have I'm 7 years or so. I'll think about going part-time.
Thank you so much. I greatly appreciate you coming here, sharing your thoughts with us. And I'm grateful for having known you and having you as a contact.
And same with me. I appreciate it.
I appreciate you. So that is going to conclude this episode of the RN Mentor podcast. Thank you for joining me. This is going to be the last episode of 2020. And we will see you in 2021, a better 2021 than 2020.
Yes. Cheers to that.
Cheers to that. Have a great one.
Thank you.
You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.